Preview. Preview.
Kasoa is on the outskirts of Accra, Ghana's capital city, and one of the fastest growing cities in West Africa. It is located in the Utilise East Municipal Assembly, also a newly created municipality in the central region.
Kasoa in itself is a market area. The language Kasoa means market in the Hausa language.
Kasoa has a population close to 270,000 with a population growth of 3%. And that tells you that it's one of the fastest growing cities in Ghana.
Every day, more than 20 houses start foundation of 20 houses daily. Our research also shows that 40 families move into Kasoa every week.
Most things in Kasoa are new, or quite new, including the constant influx of thousands of migrants from across Ghana and beyond.
We have the airways, we have the Ghana Danguis, we have the Ghans themselves, we have the houses, we have the Basars, we have the Zamama Malians, we have the Nigerians, we have a lot of them. And then now we have these Liberians also coming into the system. Nigerians are in, the foreigners, because everybody passes here. So when they reach and maybe one day the car stops and then he buys something and he's happy, he does not want to get a land to start putting structures. So it's a mix of them, but the area is supposed to be for the Guans. And the Guans are typically the Utus, who are part and parcel of our system here.
This influx of people causes its own challenges, not least social cohesion and a lack of planned infrastructure. Buildings are springing up everywhere and not connected to roads or provision of water and electricity. There is a makeshift feeling about Kasoa.
An increase in population also brings commercial viability of the area, but then it comes with associated problems. You will see people in what we call prostitution coming in, you see armed robbers coming in, all the bad things will come. But then the major issue is that simply health issues, road network, utilities under pressure now.
Health is a key challenge in Kasoa. There are 15 health facilities in the municipality, but only one is public. Kasoa Polyclinic.
Kasoa Polyclinic is the only government health facility overseeing the entire population. Formerly we were a health center, but in January this year we were upgraded to a polyclinic. We currently offer OPD services, maternity services. We have ENT and eye departments as well. We have about 10 to 12 midwives overseeing about 100 to 150 patients a day. And the OPD is overseen by one doctor, that's just myself, and a physician assistant.
In Kasoa, there is one doctor to 26,000 people. Access to health is further complicated by poor roads. Getting to the clinic can take much longer than usual.
And what be about to say 10 minutes and 15 minutes, but you're quite in your time delay on Quanosa.
Cities in West Africa. It is located in the Utilise East Municipal.
Doctor Neana, me time I saw a Benjamin won. Me call no say wada. I didn't know better nana. I didn't know better. Na me time I saw. And me catch and say, me time I saw. Me brain a hear me. I didn't know me disturb no or two puno no no die. It's not me brepa. Na me wo wie na ma me bububu dem 1 month na me tumi nsɔre. Mama me brɛ pa e wo ma wo no munti. E ma na me ma me kura mpo na odi ya wo sɛ e ba no sante e yesa na me nkɔhɔ no mu biom kura mpo.
Most things in Kasoa are new or quite new, including the constant influx of thousands of migrants from across Ghana and beyond. This influx of people
ayaresano ya gidi eduro ntoye no ya gidi se de o yare no ko ne sini nchen no o si meye do we ama no wan kasa wudi ne gidi ne ye ba kwa o ye do no ma wa yare no ebeko e o yare a eye yare a e de ko hospital ni se ebi o kwa ye ntumi ma we eduro no kwa ye be ma we eduro no na ma eduro no e be ma no e be bro na yare na e be bro yare na se na mo entumi ma yare na se ntu na be biduro na de onuma etumi ma yare na ase tu ma hospital no sebe so wo yare a ye wo yare bi wo ho ye wo empabo de ana ye wo ahaba so de so ti se huhum yare wo ono konkron empabo to me tutu sa yare no so na etumi tutu krampo a e wo se eduro so kan so what you say
not least social cohesion and a lack of planned infrastructure. Building.
There are often times when people come and when you interview them, you realize that they have visited one herbal shop or one dispensary or the other and started some medication on their own. We try to encourage them to try not to do that.
To roads or provision of water and electricity.
When it comes to abortion, because of these concussions that we are talking about, they most of the time insect certain things that at the end of the day bring a lot of problems to them. They have so many herbs that they use to insect. Others take the concussion, others insect it, and right now they've got to know of this cytotech, and they are on it. So if you talk of concussion, it's actually creating problems in our environment.
Teenage pregnancy, the Kasoa Central Region, Kasoa. I'm going to send many passes. I can't tell many pentiments. This will be better me born again, a word of God. But the word of God that the master man was on the baby, no, Esa. Until Ama Nipara Kasoa and so baby Nabrabono and society. Bible say, Srabo Fraquaya on Fasona Onina on free home. Family plan a year. What did the dinner crowd and when I'm saying, oh, plan or family? Ye blacks on Adebaqua, I may have problem. Say, ye dream baby, now we have far dream. Because I'm say, we think, but you don't plan. So, plan here. I did be out when I'm planning the old Quayana. Ograno, Yansan in India, who message I made them out in our Quamun, but so what worry a brand here, what worry now plan said the Baya, Kualana about woman, bet me I show my first say the best.
Here in Kasoa, you go around, see people, teenage girls having belly, pregnant. Always they come to the hospital. Let me say a day you see 5. So you just count for a year.
Feeling about Kasoa. Health is a key challenge in Kasoa.
To make it bunny or one of a say on the same I'm so I don't call me mammy. No, qua, no mammy riding. Or Ben who bear my crona and then a year. My was I make I not see you. Or go on can't tell me mammy no coffee, mammy no coffee address or see no damn for being a trim. So I can find no year no shade them, no locking. Tell man and friend my business say, a smith you are ban or say, on my, it's a ditching and or fair cases.
There is one doctor to 26,000.
Some even use broken bottles. They use broken bottles, they grind it and take it. And others also use other things, sugar, Guinness and a whole lot. Yeah, and it's not good. It's going to affect your immune system. Yeah.
Access to health is further complicated by poor roads. Getting to the clinic can take much longer than usual. Some women also complained about bad treatment in the hands of hospitals.
When someone is using contraceptive pills, it will someday have bad effects on the person. So I think using of contraceptive pills are not good.
These and other conditions have given rise to a...
When you use the medicine, it will affect your womb. Maybe in future you will not be able to give birth.
Given rise to a fast-growing and unregulated industry of traditional herbalists and spiritualists, filling the gap in health care. The unregulated use of medicines, both orthodox and concern for many health practitioners. Illegal abortions in
any inchine and no more different. Crawford too, or to come as a latching one, and one or Muton be drone, or Munina will be. Ah, Uko be Sasa Upa Shilena, Eddie Bon Palana, Web no be Yama.
Preview.
I don't know. A woman and baby. Oh, Akalaki Twa. What's me the bono, I'm a Makalana affair. Akalana so tumu kokra ye wo yellow can we be wo the fra na wo de asra akalana se manako ana wo yemu hwie susu a wo de haban fra na wanom e be ma wo yemu atim ana apifo so bi wo hwa ye na akono nti na ija wo de ba kwa pepa ne no bi wo didi ana ofe nti wo wi a be ma ne fie na etwa me de mempe ba menyem na do me kon di amedi bi.
Some of the cases of teenage pregnancy have led to deaths, as in the case of Mansa. Some of the cases of teenage pregnancy.
Yes, but managing Opa means the demo. My Diana Mediani Shilling. Oh, no, yeah, Diana Mecondo. Matissa almost saying you.
Metadi, but midi and me who say a mouth for baby, Cassay. And so many human air domico. Me was what I mean to me, to say a yaka grana mijai.
Unfortunately, many myths about reproductive health and contraception still persists and influence the choices many women make about their reproductive health. Young girls, pernicious myths which unfortunately feed the unsafe abortion statistics. The false link between the use of contraception and barrenness in women is one. Other practices clay, especially by pregnant women. Various beliefs about the medicinal properties of the clay exists and encourages its use. The sprawling Kasoa market has many traders selling baked clay.
Abusia for her paying 96.9 and I'm amuche the Maternal Health Channel Jubedie and I the
exhibiting dependence on baked clay, even after being told that it holds no nutritional value and can cause hookworm infection.
Preferably, some to my gynecologist because it's
of its popularity, the consumption of baked clay by over 60% of pregnant women in Ghana causes anemia or low blood levels, which can prove disastrous during child delivery. Addiction to ayilo has not yet been recognized by the health authorities as a key challenge affecting the health of women in Kasoa. However, anemia is listed
People be a leader, but me a leader or a leader or jumam, a leader or school leader or a sorry leader or and be a leader or be a leader be a yamma platform opportunity no try say at the pie media diamono who bet me I introduce at the amanco for no one so I'm for the atom especially some way more a string member was say I'm one day and sponsorship will be a muhiano yamen fandomo na muntimenye momon paba. The more I'm across the Adiwa way, I say, Obi and Kofo, a shepherd, a bayajuma, but a bit taking America to be a yana from the Obetimia or the Babuelipa, Nayana, Yame, Faso, or Tia baby as at me by Yama.
Women in Kasoa. It is important that the link between eating of baked clay and anemia is made clearer to women in order to improve their health. For pregnant women, this is to ensure that they have adequate levels of blood before delivery